For over 30 years, Humana has been committed to the care of our members. Through our expertise and partnerships, we provide whole-person health care that adapts and evolves with you, no matter where you are on your health journey. Choosing the right Medicare plan can help you get the care you need to feel your best. That's easier to do when you understand your plan choices. Humana can help. There are certain times when you can enroll, disenroll, or change your Medicare plan. The annual enrollment period is October 15th through December 7th. During the rest of the year, if certain special conditions apply, you may qualify for a special enrollment period. Ask your licensed sales agent if you qualify. Let's think about your Medicare options. Option 1 is Original Medicare, Parts A and B, through CMS, the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but not prescription drugs. So you may need a separate Medicare Part D prescription drug plan. Option 2 is Original Medicare, plus a Medicare Supplement Insurance Plan, plus a prescription drug plan. A Medicare Supplement Insurance Plan, or Medigap policy, helps lower costs by picking up deductibles and coinsurance not covered by Medicare Parts A and B. But these plans don't include prescription drug coverage. You will need a separate prescription drug plan to provide drug coverage. Option 3 is a Medicare Advantage health plan, also called Medicare Part C. Many Medicare Advantage plans also offer drug coverage, eliminating the need for a Medicare Supplement Insurance Plan or a separate prescription drug plan. You can get a Medicare Advantage plan with prescription drug coverage, an MAPD, through private companies like Humana. With or without prescription drug coverage, Medicare Advantage plans have all the benefits of Original Medicare and may have lower out-of-pocket costs. An MAPD plan is a Medicare Advantage plan with Part D prescription drug coverage. Most Medicare Advantage plans also offer extra benefits. As a Medicare Advantage member, you still have Medicare and must continue to pay your Part B premium. It's just the version managed by a Medicare Advantage company like us, Humana, rather than the federal government. Now that you know your Medicare choices, how do you choose your plan? Ask yourself a few questions. What type of plan do you have now? What do you like about your coverage? What would you add to make it even better? Is someone helping you make healthcare decisions? With these answers, you're ready to look at plans. Let's look at a Preferred Provider Organization, or PPO. With a PPO plan, you have a network of doctors, specialists, hospitals, and other providers. You can also choose to see out-of-network providers and without a referral. But unless you need emergency or urgent care, choosing an out-of-network provider may cost you more. Staying within your Preferred Provider Organization's network may keep your out-of-pocket costs lower because the plan typically pays a larger share of the cost. Here's a fact that may be important in your planning. The Centers for Medicare and Medicaid Services prohibits combining a standalone prescription drug plan and a Medicare Advantage PPO, even if the PPO doesn't include prescription drug coverage. Ask your sales agent to review your options with you. You'll also want to have the agent review the plan's prescription drug coverage and specific drug list, the medicines the plan covers, with you. Humana's list is also available at humana.com. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problems before we'll cover more expensive drugs. This is called step therapy. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand name drugs may be covered. In the coverage gap, or donut hole, you pay part of the drug cost before additional Medicare coverage kicks in. In 2019, you'll pay no more than 37% of the cost of many generics and no more than 25% of the cost of many brand name drugs during the coverage gap. If you have both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. Ask your sales agent if a dual-eligible special needs plan, or DSNP, DSNP, is a good choice for you. Now that we've talked about when to sign up, your Medicare options, PPO plan specifics, and prescription drug coverage, what's next? Your sales agent will go over two important documents. One is the Summary of Benefits, which covers many of the features of the PPO health plan. The other is the plan's drug list. If you choose to sign up for a PPO, decide if you'd like to receive your plan documents by mail or online. If you decide to go digital, we'll email you a link to Humana.com, where you can sign up for My Humana, your secure online account. Most of your plan information is in one easy-to-access place online. Go to My Humana anytime to get started, learn more about your plan, and see your documents. Your Humana member ID card will arrive in the mail. By providing your email address, you authorize Humana to send you health information at this address. We've covered a lot of information today, but if you have questions, call us. We're your partner in health and always happy to speak with you. Your licensed sales agent who presented your specific Humana plan benefits today can answer any of your questions. Another great resource is the Medicare and You handbook you should have received in the mail. You can also go to medicare.gov. Thank you for your time and interest today.